So just Mick's already introduced me and I said a little bit about myself, but I'm the Children, Young People and Families Lead at BACP, and I've been, working on various bits of work with Mick over the past 18 months, really. So just by way of background, BACP and the University of Roehampton have got a long working relationship, and really it shouldn't be me here today to deliver this presentation. And the reason I say that is we've got a research team at BACP, and our senior researcher who went on maternity leave just before we started this piece of research was covered for a while with somebody who worked with us, Duncan McCaig, for about 10 months. I think Duncan was with us, maybe a little bit longer. And then Duncan left for a job in Scotland, and it felt very unfair to ask Charlie Duncan to deliver this, because she hadn't been involved in the research, but she will be involved in the research as it moves forward, because it's a longitudinal study. So this is, now this is a problem we have. I was just about to move on to the next slide, and Mick, it's not working even though we've tested this. Any advice?
Yeah, Joe, if you want to stop screen share.
Yep, thank you.
And then go back to screen share. I can always run it from my computer if needed.
Yeah, let's go for that.
Okay, do you want to try it again, or do you want me to go straight and do it?
I'll try it one more time. This was always my fear when I worked in secondary schools. If I ever was doing an assembly, I had young people on standby to, it's working. So you can see that. And there is one of my young people that I worked with for a number of years, who's my good luck mascot. So that's Liam. So I'm going to start sort of just setting the scene really around school and college counselling in the UK. So I've said a little bit about my role. So I started in 2019. It's a UK-wide role. The remit really is perinatal to university student age, so up to 25. We like to keep that open to 25, because there's, we don't want to stop working with young people or looking for funding streams that stop working with young people as soon as they hit 18, because that can cause, a number of issues if they're going into adult mental health provision, etc. So the role is UK-wide. I work particularly closely with government officials across the 4 nations. So the main work in Wales, I've been linking in with them ever since starting, really, with the government officials and the counselling leads in Wales. The Welsh government are the only government that provide school and college counselling on a statutory basis, meaning by law, so it's in their law books. And counselling has been happening across schools in Wales for a number of years. I also work with officials in Northern Ireland and in Scotland, where in Northern Ireland money is ring fenced, and in Scotland funding for school and college counselling has been sort of launched over the past couple of years. So there's £20 million being spent on a 5-year period for school counselling, and college counselling has a different budget attached to that. So delivery of school-based counselling across the UK is different, across the 4 nations. We very much use the Welsh and the Northern Irish model as exemplary good practice, as they've been delivering the models for nearly 10 years, really. Within England, it's different. It's patchier. There's a number of in-house on-site school counselling services that operate. And in a survey that we did a couple of years ago, it was looking like secondary schools and FE colleges in England had around about 80% access to counselling provision. That has changed, I think, recently, and there's a smaller amount. So the Institute of Policy and Public Research, IPPR study. These slides will be available afterwards, and there's links embedded. Carried out some research in October 2020. And it looked like via the responses that they got, that in-house counselling provision in England had reduced to around about 48%, and that may have been due to budget constraints, etc. But what they did find was that school counselling provision was more likely to be offered in the independent school sector and in schools in more affluent areas. Schools with healthy budgets basically could afford in-house counselling provision. So that inequality around access and availability is really highlighted in that report, and is of concern. So just moving on. Oh, beautifully. I'm so pleased that that just happened, and it just seamlessly moved on to the next slide. Just wanted to set the context really across the world. So WHO carried out a survey again in October last year, around 130 countries, just to look at the level of services that were available and how much disruption there had been due to COVID-19. And across the 130 countries, they found that 93% of countries worldwide, the mental health had decreased or disrupted, while the demand for mental health is increasing. So 72% reported disruptions to mental health services for children and young people. And with that, within those figures, 67%, and this is a really large number, saw disruptions to counselling and psychotherapy. So that's across the 130 different countries, and that really echoes our learning from what's happening across the UK. So around 3/4 reported at least partial disruptions to school and workplace mental health services, again reflecting what's happening in the UK. And just lastly, although 89% of countries reported in the survey that mental health and psychosocial support is part of the response plan, only 17% of those countries have full additional funding to cover these activities. And if you think about that from a policy point of view, I mean, we had the budget today, and we're hopeful as ever that there's going to be announcements around children and young people mental health, and that counselling would fit into that somewhere. But what we got from the budget today was very much it was a different angle around businesses and getting people back to work and furloughing, etc., which is all very important. But the mental health implications in the budget today were just around working with veterans and providing mental health support for that generation and for people that have come out of armed forces, and also for there's going to be some additional money for domestic abuse, which is really welcomed. But there's a chance that has been missed really around how we're going to provide the mental health recovery support that is so needed. So moving on, I wanted to bring in the reports that Young Minds have been doing. We work really closely with Young Minds within the policy team at BACP and have a really good working relationship with them. That they always talk about counselling, and when I summarise at the end with some of the policy work that we've been focusing on, I will come back to Young Minds. But in their latest report, counselling was mentioned 12 times, which is really welcome addition. But they picked out some really key points. Their survey, which was UK wide, has gone out to around about 2,500 young people. Across the 4 nations, and they found out children and young people were reporting back that you can see the stats there. 75% this current lockdown was harder than previous ones. A high percentage, 67%, believe the pandemic would have a long-term negative effect on their mental health. And when you look at some of the stats within the report, this report this time round found that more young people had struggled and suffered from bereavement and loss. There'd been death of people that they knew linked to COVID. So that had such a huge impact. 24% said they'd looked for support but not access this, and sometimes that is around not wanting to access online support. The survey results here again are going to echo some of the findings that we had ourselves, around the lack of privacy, not having the right space, and really not there's challenges attached to accessing counselling remotely. So 49% who were at school and college didn't think their school was focusing anymore on wellbeing following the pandemic. And one of the things that we called for as part of the return to school, and when I say return to school, I know schools have been open, but the return to school for the majority of students was a mental health catch up. And one of the things that Young Minds are asking for is a children and young people's mental health strategy. So there's a number. I think if for schools and colleges where there are additional services, whether there's in-house counselling or mental health support teams, or a variety of other people more of a mental health remit, you know, there will be lots. There will be lots more offered, we would hope, but many schools, they've got resources, they've had training, there's the Anna Freud link project, there's all sorts of things that schools can tap into, but you know, young people are believing that the focus is not there on mental health and well-being. And just lastly, I just wanted to pick up from the Young Minds report that 55% said that there was a counsellor or mental health support team available in school. So that's an increase, because only 40% in the previous survey had said that they couldn't access a school counsellor. So it's good to know that that percentage has gone up as we've been learning through the pandemic, really, and as we've opened our resources or contracted more, I would say, with children and young people that we're in contact with. So moving on, I just thought it might be useful just to share a definition of school and college counselling. It's one that was used in the first bit in the EFOS paper, and so it'll be recognisable. So it's a form of psychological therapy that provides young people with that empathic and non-judgmental supportive relationship to find their own answers to their own problems. So it's just to sort of just to focus on that. And I wish boundaried was a word that came up without going through a spell check. I think we should campaign for that word to be in the dictionary. This is to offer a safe and boundaried space for children and young people to talk through their difficulties, again with that agreed confidentiality, and really importantly, you know, that counselling, that CYPF counselling, you know, whatever membership body that you're part of, you've got a competence framework to work to and to work through with your own CPD. So there's a little bit about definition of school and college counselling. And I will emphasise at this point that I always do talk about college counselling. I work really closely with the Association of Colleges, and I'm delivering some work with them at the moment around supervision training for pastoral staff in college settings. And we do always include college, because the college world often gets left out because we talk about school counselling all the time. And I'll define school counselling as we go through into some future slides as well, because that's a bit wider than just schools. So the aims of our research, I'm just sharing a lovely picture there as well from a colleague in Scotland who did some blogs for BACP's website around, you know, going back to school in September, and then one more recently after Christmas, and you can see her perspex screen and all the extra bits to clean the room there. I just thought that was a really nice picture. So our research aims better understanding for the provision of counselling and psychotherapy in UK primary, secondary and FE college settings, and to investigate really how COVID-19 has affected the provision and what really is needed for the future as we move forward, and then of course how the research links to policy. So our method, we're getting closer to talking about the actual research now. So the survey itself was inclusive of practitioners working with young people from 5 to 18. So we did focus our work on that sort of cutoff, that age, even though I've said earlier that our work is 0 to 25. But for this particular piece of work, we were looking at school age, though there would be some flexibility there with sixth form and sort of 19-year-olds. So participants completed self-report surveys online at several points. So we launched the survey in late summer with a closing day in July. And thank you to all those people that took part in our trial tester to begin with, because we had to try and get the survey down to 20 minutes. It took about 30 minutes, I think, to begin with. So it was about a 20-minute survey. 742 practitioners from across the UK took part in that. And then that was closed at the end of July, and then we opened the next one closing just before the end of December. And we asked all the participants that took part in the initial survey if they would be happy to take part and consent to take part in future surveys. So we have a number of it's higher than 206. I've just got a note here. It's 385 people in all. So around about half said that they would consent to future studies, to future research. And just to say as well, I haven't mentioned ethics at all, but we got ethical approval from Roehampton, and that's where the two sort of coming together of organisations was just brilliantly sort of fused together, really. So a lot of the research that I'm going to go into is going to focus on the 206, because we can make some comparisons between what happened before and what happened in July, and then what was happening in December. And our next cohort of questionnaires, our next bit of research, will go out on March the 17th. We're leaving the closing date open till April the 11th, just in case people are absolutely shattered after their term and the Easter break, and it will just give people that little bit of flexibility to take part in survey number 3, which is going to be really exciting, I think, because it will just map all the different changes and lockdowns and capture that beautifully, we hope. And then lastly, we'll be doing another part of the survey at the end of July. And just want to share something with you. Just before uploading this PowerPoint, I'd noticed it said end of July 2011. I think I'm sometimes caught in a time warp, and where has time gone? I hadn't even noticed it said 2011. I thought it could have easily have been 2011 for me, but luckily I noticed that just in time, because somebody else would have done. Okay, we sent the membership, the survey rather, was inclusive of practitioners. We'd estimated that across the UK, with various information that we've gathered, that there's about 10,000 therapists working with children and young people, and that will be in many different professional membership organisations. So we sent the survey out to as many as possible, and you can see the breakdown there. And I think that's really good, because I think if it was things need to be shared, and we need, we've got we're working in a climate really of working together with other professional bodies, and that's so welcomed and something we are really committed to at BACP, and it's just good to have other membership organisations involved. So we looked at there's some interesting data that came through that I'm just sharing with you. It's just interesting to see the different roles that people are working in, and how they classify themselves. So and really similar in the summer and autumn, not that much difference. So around about 75% of oh, I'm terrible. 3/4. My maths is just so awful. Around 3/4 of people surveyed identified as counsellors, and there's the breakdown for the rest of it. It always gets me, maths. So settings where counselling was offered. So interestingly, secondary education is again around about that average of around about 75%. We looked at colleges was consistent with the with FE. There was a bit of a we lost a few from primary education. Really good to have information from pupil referral units and other alternative education settings, because again, when we speak about school counselling, but it's really counselling delivered in whatever setting it's provided in. I know when we were involved in updating the Welsh school toolkit. It very much was about Welsh school and community-based counselling. So we know that lots of services provide counselling in schools from the third sector, etc., which moves on really to just looking at the roles, because another little interesting bit that we were able to get from the survey was just that breakdown of whether people were employed, within the school, whether they were working in voluntary sector providers. So that gives us a little snapshot really of the stats that to some extent complement the IPPR. Obviously the pay 59% of counselling that would be in-house, and the IPPR study got 48%. But we could argue the difference of 10% there, but it's not too far away, and we're only looking here at 206 participants, so that was quite interesting. And moving on, you can see the number of trainees and volunteers there as well. I'll talk slightly about our campaign again here, bringing it back to policy, in that when we're campaigning for funded school and college counsellors in England, we are campaigning for paid workers, and we know that there will be some volunteers that choose to work in schools, but we would love to be able to move away from volunteers having to work in schools, because that's the only way that they can get the experience. A paid counsellor in every school is something that we are really keen to campaign and lobby for. Okay, so moving on. So here's the results. So again, this is the first survey. It's going to be slightly different for when we compare the summer and autumn. So we found really that the typical number of counselling hours in an average week was around about 14, as reported by respondents, and then that was reduced to 8 during the summer. So it went down, just round about, well, this is my maths again, we'll call it half, but not quite. And then it was up again in the autumn term. And it was not quite to the same level, and that makes me wonder about did people need time to clean rooms? Was there extra things that was causing that slight change, because there was other things that counsellors had to do to keep their rooms safe? So there was a number of reasons why counselling were ranked as why it didn't take place in the summer term, and I just thought I'd just highlight the top. Well, I wanted to highlight the top 5, and then I thought the rest of them were really interesting. So yeah, schools had been closed, clients weren't able to access remote therapy without others knowing. That's a real big thing that we hear consistently and persistently. Schools had reduced or stopped the provision of therapy. People hadn't got the appropriate spaces. Clients hadn't got spaces. Some clients weren't interested in remote therapy. I'm using the word clients here because that's what we used in our research, clients being children and young people. Not being there was something around not being able to provide therapy that was appropriate to development stages, and clients not having sufficient access. And you can see the list goes on, including counsellors themselves not feeling psychologically capable of providing therapy at that time. It was a really, really worrying time for all, and so there's so many different reasons. And counsellors themselves didn't always have the space to provide therapy. I mean, at the beginning of this presentation, we were talking about people swapping rooms in houses just to find space. It must be exceptionally hard if you're trying to find the space to either provide online therapy or to receive that. So moving on. Okay, so our survey results. Now, unfortunately, on this slide, I'm just going to talk through what they say because you can't see all of the detail. There was nothing that we could do about that, I'm afraid. I need to just move, if I can, the picture of myself because I can't quite see. That's it. I've Move myself. Okay, so the titles at the bottom are hours of face-to-face counselling, hours of face-to-face counselling with sort of face masks, etc. Hours of video and audio, hours of audio only, hours of synchronous, so that's chat based counselling, and the last one is hours of text-based, what we call asynchronous, so emails. So we can see that from the 206, 13 hours of face-to-face counselling were reduced in the summer to 1 hour there, and in the autumn to 1 hour. But the good news is that hours of face-to-face with following sort of COVID restrictions and health and safety, the hours were up to around about 10. So counselling was taking place in the autumn term, but that was with days. Hours of video and audio counselling had gone up, so it was none that was reported before COVID, and you can see there that had gone up to well, a combination of 3 and 1 there. There's more hours of audio as well. I tell you, one of the things we did find that was I found really interesting was that it following our competency framework and following you know, all the training that was available, it was about video platforms and telephone counselling. That's what was happening. People didn't go down the chat route. There's a completely different set of competencies for that. And what I found, you know, an organisation such as ZenZone and COOF would be the experts in that area, and other counselling organisations offer that as well. But it wasn't something that the workforce moved into. So I think that in itself was interesting, and I think before then we just put everything in the title of remote counselling. Actually, remote counselling is a number of different delivery styles, depending on what you're trained and competent to deliver. So I shall move on. Just some sort of key points to share, really. So, and this is for a mixture of the both. So, therapeutic sessions were slightly shorter in summer and autumn. Again, that could be, as we were saying, due to cleaning rooms, etc. Waiting times for therapy had slightly increased in the autumn term compared to before COVID in the summer term. We were expecting a huge increase. That's not what we found in this particular second survey. But again, it will be interesting to see what results we get in the March period. So the results from January to March. Contact with educational staff was, again, as expected, slightly reduced in both summer and autumn. And I say we expected that as schools were shut and in the first part, and I guess the contact with staff had just there was safeguarding contact. We've had that anecdotally, but there wasn't as much sort of on-site support from staff, but it's only slight. Contact with practitioners, therapeutic colleagues and supervisors appeared completely unaffected by COVID. It was exactly the same. So that was really good news. And contact, this is an interesting one as well. So excuse me, contact with children, young people's parents and guardians was slightly higher in both the summer and autumn terms. And again, some of the things that we've been hearing is I think some of it was down to contracting and suddenly delivering sessions, you know, in a different way because of some of it might be remote or blended, that there was more conversations happening with parents, and we've picked up on this in the Children, Young People and Families Divisional Exec, and we're going to be delivering a workshop looking at work with parents in the CYPF conference later this month, because that seems to be something that's been coming through from a number of different sources. CYP referrals to therapy decreased following COVID in the summer term, but increased from the summer terms level in the autumn. So I think when schools first went back, the referrals weren't coming through as fast as people anticipated, and again, you know, in the autumn term, referrals to therapy just they just weren't as prominent, and we're expecting that lull has changed more than somewhat. So it'll be, again, very, very interesting to see what happens next. Okay, one of the things that we looked at was competency levels for different modes of delivery, and I think the biggest increase there, everything else is absolutely stable, was and the same, was that by the autumn term, so from September to Christmas, therapists were much more competent to deliver face-to-face counselling with social distancing, and I think there was a lot of work that went into that beforehand, and was available on you know, on the BACP website, but also through you know, people that worked for services and you know, third sector services, particularly shone with some of the data collection that we had, because people reported back that the advice and guidance from the organisation that they worked for was exemplary. So that's really good to know. Of course, before that, there was all the issues around insurance that needed sorting out, and there was so much misinformation, and insurance companies weren't always giving the information. Insurance companies were saying go to your professional body was saying go to your insurance company, but that finally was sorted during that autumn term. So one of the other things that we looked at was COVID-related issues that were coming in. So in the summer, it was around about 54% of COVID-related issues, but that fell in autumn as some sort of sense of normality, even with social distancing, returned. Again, I'm saying this again and again because this is we're doing this study in 4 different parts. There'll be a change again from January to March, and that'll be interesting to track that. The main issues that were coming through, I'm going to say thank you to Charlie for doing this, putting this together for me, because every time I tried to do any sort of WordPress, it just was chaotic. The main issues that were coming through, which really echo the findings from Young Minds, were anxiety, isolation, and fear. Now we're going to do a little bit more looking at insight, a look into some of the issues that have been coming in, and Charlie's going to look at some of that data and see what other themes that we can pull out, and it'd be interesting to link that and capture that throughout the next few months. So the priorities, this was taken from the first survey, and it was a number of predetermined statements that people were to rank. The top 7 priorities, if you like, was, and which is really helpful for policy work, a greater recognition of mental health as a critical service. Every time we do any policy work or lobbying or talk to governments or talk to commissioners, this is very much what we do. Again, another theme that was coming out, and this is a theme that I think was there before COVID, was a private space to provide face-to-face therapy. I mean, it's the traditional counselling room in schools is always been a tricky one to provide that confidential space with people walking in and all the things that happen around you know, your counselling room. So it's interesting to see that as well. A private space for clients to attend remote counselling. So that's a more blended approach, perhaps when the therapist is working at home or from an office or a separate building, so that the clients have access within schools as well to access counselling. And that's something I know that has happened with a number of schools being open in this last quarter, with being open to children and young people from key worker families, or through, you know, being at school because of more vulnerabilities. So they've been able to attend some remote counselling when they haven't had face-to-face. Research impacts into COVID-19 on children and young people. There's lots of studies going on at the moment. I think some of the biggest impact is going to be you know, as we move into the future, and it's going to be I think there was an article in the Guardian a few weeks ago that said it's going to be you know, could be over the next 20 years that the impact is still going to be having some effect on our children and young people. Ways to contact young people who are not currently attending therapy during term time. Again, that's one of the things that has been more sorted as people have recontracted. We've learned from the pandemic. We've learned that we didn't always have access to information to be able to contact people via schools, but we've been able to contract that in as therapists this time round. Appropriate technology for clients to attend remote counselling. Yeah, I mean, that links very much again to, I haven't mentioned digital poverty yet, but I'm going to mention that in the policy roundup. You know, not all young people have access to either the devices or free or the Wi-Fi, the bandwidth, all of those things, and again, not the space. And guidance and training in providing therapy remotely. And there's been lots and lots of courses that members and counsellors have been attending to upskill. Okay, these were just a few themes that I just picked out just from some of the anecdotal stuff. Again, I think one of the interesting things, and this came through a number of times, is how to work online with under 10s. So again, one of the workshops that we're putting on at the CYPF conference is around working creatively with under 10s online with another responsible adult in the room. So there'll be one of a counsellor who works in this area and has been for a number of years, has really developed some great skills around using play online again, and she'll talk through at the conference around how you have that other person in the room. Other things, safe platforms. I mean, BACP have been asked time and time again, you know, what platforms are the safe ones, but we have to ask people to go through their own, processes around data protection and GDPR, etc. So we don't say this one's safe and that one isn't. It's a process to work through. Consistency across schools. So there was people reported that they might work across 6 schools, but each school had a different way of delivering counselling or enabling counselling to happen, whether that was remotely or not. So some sort of call for schools to understand that counselling is a professional service that works within its own sort of remit and guidelines, and can go to different schools and put all the risk assessments in place. Therapeutic boundaries came up, and that was really around some of the indication was around therapeutic boundaries with teachers and school staff, so that there was a better understanding of what that meant, including what counselling is and what counselling isn't. We had a bit of feedback as well that we needed easier to digest, faster guidance on our website. We've tried to make it more concise and to be nation-based as well. Other people talked about networking opportunities and sharing resources, and that's something that I think we'd be keen to look at around different platforms that we could share resources that would be useful to all. Okay, so moving on, let me just check the time. Well, we're doing quite well, I think. Some of the limitations of the research, well, it was a self-report online survey, so there could have been some issues around people only responding if they had a bug to bear or something. I'm not explaining that very well. I made some fantastic notes that Mick gave me, so I'm going to look at these now. It could be slightly biased. For example, if there is not enough school and college counselling going on, so people would be keen to make that point. But and perhaps something of the fact that it was you're reporting back to a professional body, it might not always feel completely independent, really. The survey was only completed once at the end of each term. That's, if maybe we could have captured something mid-term, it might have shown some differences, because change can occur, really, really rapidly. And another limitation of the research, it doesn't really capture the issues counsellors are working with during the pandemic, although they reported, some key things. We need to do a little bit more work with that, and that's something that the BACP research team are looking at the moment with our wider membership. Okay, so I'm going to whiz through these because I have spoken longer than I intended. So initial research findings were shared with the Department of Education to show that we had a workforce that were ready to go and could work sort of competently online. I think 94% of people surveyed said that they had spent time to upskill in their competencies to deliver remote and telephone counselling. We've gained support from YoungMinds, the Centre for Mental Health, the Mental Health Foundation, all calling for counselling provision in schools in England, in line with the rest of the UK. We've had a number of MPs from cross parties sign up to an early day motion to call for counselling provision to be funded by the UK government. We've developed a school and college counselling expert reference group where we have around 20 practitioners that are UK wide that are going to that are helping influence our policy and campaign work. I recently responded to the government green paper, Transforming Children and Young People's Mental Health Service. It was a health and social education committee inquiry looking at some of the work in the trailblazer areas around mental health support teams, and we were able to share our research findings there. I mentioned digital poverty and inequalities. There's always more work to do there. We can't make any assumptions that young people have access to all of the devices that they need, and young people from more vulnerable and backgrounds where there is socioeconomic deprivation might not have the same access as other young people. There's implications for future counselling provision, because we've got some data around from 742 practitioners, and it's a longitudinal study, and we're collecting data all the time just to give us an idea of the workforce. I've put something in there about a budget response. The budget was today, and we were quoted in an FE newspaper around the need for school and college counselling. I'm only going to whiz through this one really quickly. It was from the Journal of American Medical Association, just to capture some of what we've said, that people haven't got the private spaces. This is all information collected in America. But one of the things that I really wanted just to highlight from this bit is that in one of the studies carried out in 2012 to 15, it was reported that 35% of young people in schools only received their mental health support from schools. Now that really made me wonder about future research. You know, how many of our young people just get their mental health support in schools? I think that'd be a really, really interesting question to ask. And finally, I'm nearly getting there. There was an article in the University and College Journal magazine that just this March, a fantastic article by Sarah Hines, who talks about how well, you know, we've been patting ourselves on the back to say how well we've done, really, that we've become trained in delivering, you know, remote therapy, counselling online. But she really looks at what we've missed, and do all young people, or do all people really want that? So there was a quote that I got from that she'd quoted: "Our minds are together when our bodies feel we're not. That dissonance, which causes people to have conflicting feelings, is exhausting. You cannot relax into the conversation naturally." And I can feel that a little bit just by talking sort of live to you now, because I can't see you. I'm not with you. It would be wonderful if we were all at Roehampton. There wouldn't be as many of us there, but there'd be a different sort of connection. And I'm just going to finish with the quote from the Young Minds report: "I don't want to do counselling online. My room is not a private space when I can discuss things I may want to. And I know from counselling that I've had in the past that the ability to go somewhere separate and talk to someone in person is a big part of why it worked for me." And I really sort of, want to just sort of highlight that, because counselling online isn't for everybody. It isn't for all therapists, and it isn't for all children and young people. And I've put a picture of Mick there because I was hoping that the any question bit, Mick can come in for the bits that I've stumbled through a little bit chaotically when looking at some of our research findings. I know Charlie is somewhere in the background as well, who may be able to help. So it's over to Mick to unmute us, or to feed some questions that have come in through the chat. And at that moment, I'll take some water and have a drink.
Well, that's fantastic, Jo. First, can we have a round of applause for a fantastic presentation?
Thank you. It's really hard talking about research, not as a researcher, and I just would like to add that.
You have done fantastic. It's so valuable, and I think you did a great presentation about it. So do you want to stop the screen share? I'm going to turn